Hello everyone, welcome to today's topic. Today's topic is Genu, valgum and Genu, varum. Before moving into today's topic, today we are going to learn few terminology that is very important either in anatomy or orthopedics that helps you to understand this topic as well as further topics while you read anatomy or orthopedics like knee or lower limb etc. Okay, one is we should know the other terminology for our joints like knee joint, hip joint or elbow joint or whatever. In our books, if the given coxa, it means hip. If it is given genu, it is knee. If it is given cubitus, it means it is elbow. So these are the other words we use while we are reading. In the similar way, in today's topic, if we say genu means we are talking something about knee joint. Genu valgum, genu varum. What is an valgum varum? We will learn in the further topic. Okay. So the terminology that we have learned now is coxa means hip, genu means knee, cubitus means elbow. Okay. Now, to understand this topic, we have to learn certain words. So, these words I am explaining now, keep in mind these are not the exact definitions of the terms, but these things that I am explaining now will help you to understand the topic. Okay? So, the other two words that we are going to learn now is proximal as well as distal. What is proximal? What is distal? See, if something is near to the center or to the point of attachment, then we will name it as proximal. For example, while studying anatomy, usually center means trunk or body. If something that is near to the trunk or the body, then we will say it as proximal. In the similar way, if the part that we are talking is away from the trunk or the body, then we will name it as distal. Okay? For example, assume this is an hand or upper limb that I am talking now. Begins means, for example, shoulder joint. Ending part is that wrist joint region. Okay, then what is proximal, what is distal means we just take this as elbow. This X mark that I have kept here is elbow. Okay, then from the part that is from shoulder to elbow becomes proximal because it is near to the point of attachment or our body, whereas the part from elbow to wrist becomes distal. Okay, but if you are considering starting point as elbow and wrist as the end point, then elbow becomes the proximal region. Okay, so the topic where we are starting, the point where we are reading becomes the proximal, and the part that is away from that attachment becomes distal. Okay, now we have learnt about coxa, genu, cubitus, proximal, distal. Okay, now we will learn about medial and lateral terms. Okay, what is medial, what is lateral? Before learning this, you have to learn one important word, that is anatomical position. Anatomical position, which is very important for the first years. Okay, anatomical position. What is anatomical position? This should be understood to learn the further topic. See, this is the anatomical position. Anatomical position means where the person will be in standing position and his legs are very near. His palms should be facing to the sky. This is the anatomical position. Whenever we are reading any definitions in anatomy or orthopedics or any other subject further, it means wherever you mention anatomical position or definitions, it means that we are talking about a person, imagining that the person is standing like this. Okay. Now, the terms medial and lateral means, see what is medial? Towards the midline of the body. If you assume this thing as sketch of the anatomical position, this becomes the midline of the body. Whatever is in color, line, dotted line, that is midline. So whatever is towards the midline of the body becomes the medial region. Whatever is away from the midline of the body becomes the lateral. For example, in the given diagram, the highlighted part, which is highlighted in pink region, becomes the lateral part as it is away from the midline. and whatever part is highlighted in yellow becomes medial. For example, if you consider this anatomical position, the thumb region, thumb is away from the midline, so it becomes lateral to the body, whereas the little finger is near to the midline, so it becomes medial side of the body. Okay, so the proximal, distal, medial, lateral, all these are the basic terminology that one should know to understand certain definitions in medicine. Okay, to understand this concept, I am showing this diagram. Hope this is clear for you. Okay, the same thing that we have learned till now is shown in the diagram. See, a person is in anatomical position. You can see the person clearly is in anatomical position. In anatomical position, the person palm should be facing upside. Okay, and this is the right left of the body I just mentioned. These are not anatomical definition terminologies. The midline is here also represented like a dotted line, as you can see here. This is the midline. Now whatever terms we have learned, see, the proximal, which is near to the trunk became proximal, which is away became distal. Similarly for lower limb also, the one that is near to the trunk of the body became proximal, the one that is away became distal. Okay, and the one near to the midline becomes the medial side of the body, the one that is away becomes the lateral side of the body. Hope this is clear for you now. I'll once erase all the highlights. You can see the person is in anatomical position, and you can clearly see the labelings where there are proximal, distal, medial, lateral and midline of the body. Okay, now we will move towards the main topic for today. What is Genu valgum and Genu varum? One thing for easy remembrance, this is the tip I am going to give you. Varus means near. From varus you can take this AR terminology, like near also we have AR. Valgus AL, lateral AR. First remember like this. After end of the topic you will understand why I said this. Okay. What is varus means? When limb is moving towards the midline, it is known as varus. Valgus means when the limb is moving away from the midline. Which part we have to consider? For example, while we are studying Genu valgum or Genu varus, leg becomes the distal part, and the limb that you are talking here becomes the leg with respect to Genu valgum or Genu varum. I hope it is clear. See, again I'll tell. Genu varus. Genu varus, the leg moves towards the midline. In Genu valgus, the leg moves away from the midline. I'll explain this here. See, Genu valgum, as I've said, AL, immediately it becomes lateral. Lateral deviation of leg is Genu valgum. Varum, near. Near is, if something is moving near to the midline, what it becomes? It becomes medial. So, medial deviation of leg. And you have to understand the pathology, why this is happening. In what happens in Genu varum, what happens in Genu valgum. See, for example, this is the image that we are going to use for our understanding purpose. Okay, for example, here I will mention first what is this. This is Genu valgum. This is Genu varus. Why this? I will explain it. See, first what we have said, valgum. Valgum, immediately you have to remember, valgum means lateral. What is lateral? The leg. When we are talking about Genu, the leg becomes the distal part for that Genu. So the leg is moving away from the midline. If you think this is midline, here the leg is moving away. If there is lateral deviation of the leg from the knee joint, then it becomes valgum. What is varum? Varum means you have to remember near. For Genu, we will take leg. When leg is moving near, near means medial. When, if you consider this as a midline, if the leg is moving towards the midline, it becomes Genu varum. I hope it is very easy now. Valgum means LA, lateral. Lateral. If the leg is moving lateral away from the body, it becomes Genu valgum. What is Genu varum? Varum means AR, that is near. If the leg is moving near to the midline, that is medial deviation of the leg is Genu varum. And another tip I will give here. See valgum. How I remember this is valgum means gum. If something is gum we have kept here, the both knees will get attached to that area. So valgum means immediately the joints come very near as if some gum is kept. This is just to remember purpose, not exact definition. The exact definitions will be lateral deviation or the medial deviation that one should remember. Okay, this exact angles, how much is there, that is not actually the main purpose here one should understand what is the concept. Okay, now I will explain what is the pathology, why this is happening actually. For example, first we will learn about varum. Okay, varum also, which part is getting injured? If you want to remember, just remember AR means near, near means medial. So here injury happens to the medial growth plate. We all know our bone will have a plate that will be growing, and this cartilaginous growth is needed for our bone to grow, right? Similarly, here as you can see, in varum, varum means near, near means medial. The medial side of the growth plate gets damaged. Here you can see that there is damage. Then what happens? This part, half part of the bone doesn't grow, and the other half, lateral half grows. It grows, it grows, it grows, it grows in much higher length. So the growth will be in the opposite side, that is lateral side. So the medial side will be disrupted. In a similar way, in valgum, the lateral side of the growth plate is damaged and the growth is present on the opposite side. Okay, this is the pathology, why the in valgum and varum the legs are moving or deviating to one side of the body. Okay, so in Genu valgum there will be lateral growth plate injury, so the medial side grows, whereas in Genu varum injury will be to the medial growth plate and the lateral side grows more than the medial side. Okay, normally also in our body with age or within certain conditions the valgum varum positions will be changing. Okay, normally also some angle will be there won't be like 0 degrees will be present like that. Okay, now we have to see whether the varum condition or valgum condition are present in either one leg or two legs. See, if bilateral Genu varum present. What is varum? Varum means near, near means near deviation. Then like the exact image that we are showing here. This is varum. Similarly, both legs we have varum, and the both legs when we have varum, it is leading to bow legs, as if legs are like this. Bow legs. Bow legs. If in bilateral limbs we have Genu varum, it leads to bow legs. We have to learn what are the important conditions in a child as well as an adult that is leading to this condition. The most common condition in child is rickets. Why if you see a small child with bow legs, then you have to assume the condition might be rickets. But most common cause in adult is osteoarthritis. This you can see even in elderly age people above 50 years in whom osteoarthritis is common. You can see the position of legs will be in varum position. Okay, now what is bilateral Genu valgum? Valgum, as we have known that valgum means lateral deviation of the leg. Here see, from the midline it is moving away. This is valgum condition. If for bilateral condition is present, it is causing knees in valgum position. This is also known as knock knees. You can see as if some both knees are attaching, coming closer. So it is known as knock knees. Usually in a child we don't know the exact cause, it is idiopathic. But in adults you have to think about rheumatoid arthritis. So the bilateral conditions are important for objective type of pattern of questions. Or you can see in sometimes radiology can give x-rays to identify the condition as whether it is bow legs or what is the important condition that you have to look for in a child. Like that the questions might be given. Okay, so for today's topic I think it is easily understood now. We have learned about certain medical terminologies like coxa means hip, genu means knee, cubitus means elbow, proximal that is one which is near to the point of attachment, distal is away, and medial versus lateral where medial is towards the midline, lateral is away from the midline. So when you're talking about genu, valgum or varum, the distal part of the body, for example in genu it becomes leg. If it is moving lateral to the body, it becomes genu valgum. If it is moving medial to the body, it becomes genu varum. I hope now all these terminologies are easy for you, as well as you can remember them easily, and the objective types are also important. Similarly, now I have taught you about genu valgum and genu varum. If the same condition is given like cubitus, we have learned that cubitus means elbow. So for cubitus, if they have given the condition is cubitus in valgum, then you have to see whether the distal part is moving lateral. So the angle that we are talking here becomes the carrying angle. So the carrying angle topic, cubitus valgum, cubitus varum topic is important for first year people who are studying anatomy. I think this now clears all your doubts. If you have any further doubt, you can ask. Thank you.